has contributed greatly to the Serbian health sector in the past 22 years. Actually, among the candidate countries, Serbia was the first beneficiary in terms of assistance in the health sector. Everything started with the UN sanctions and went on ever since, with support to supply the necessary equipment, medicine, and providing training, so that today we still have two active university levels schools that are still in place, the one on health management and the one on public health. The EU provided assistance to prepare large works of investment, financing being provided by the European Investment Bank, in order to refurbish 20 regional hospitals, the Torlak Institute, and the 4 university clinical centers. EU has helped build the Serbian Medicine Agency, its Health Institution Accreditation Agency, and many of the reference laboratories. Without the assistance of the EU, probably Serbia would have had a much more difficult time in overcoming the COVID pandemic. With the support of the EU and the investments done in the health service, Serbia has managed to do great during the pandemic. The EU-funded project addressed the need to replace the traditional open surgery with new non-invasive techniques provided by the laparoscopic ones. The focus of the project was twofold. On one hand, resulted in the hospital of Smederevo benefiting from last generation surgical equipment and advanced training for the top surgeons of the hospital, and by so it was established tight network of specialists both in Romania and Serbia that can cover the whole cross-border area. The second advantage and direct result of this project was that a lot of people many of them from disadvantaged areas are now benefiting from top technical medical investigation. And since the completion of this project in 2019, more than 1,800 medical investigations have been carried out and 825 surgical interventions were carried on. Those are tangible results, and we are confident that the people of the region are happy that they have access to such high level standards of health care. Aside from its support to acquire new state-of-art medical equipment and capacity building, this project massively contributes to forging a network of high-trained specialists in this border area. In this case, specialists in laparoscopic surgery, both in Timișoara and here in Smederevo, covering a big part of the cross-border region between our two countries. On the same time, this project facilitates an integration and uniformization of medical services available in the cross-border area, an exchange of know-how, and a system of burden sharing in case of emergencies and other disasters in our region. This project actually has a relevance as well for the fact that this year in Europe we have the European Year of Skills, and that gives us the chance to recognize and support the talent and the competitiveness of the people involved in healthcare system. Actually, EU cooperation and assistance in the healthcare sector is instrumental in the development and the citizens' awareness. If you ask in Serbia the citizens where they see most of the EU support, many of them will answer the health sector, because it's something where they are involved at personal level. And any difference we made in the health sector, it's felt directly by each and one of the Serbian citizens. Every intervention that is done as a result of this project helps build capacities and awareness. And the public senses that in the encounter with the public health sector, they enjoy better services, high-level services, and a bigger chance of recovery from their diseases. I think aside from this example in the health care system, we have one area where our cooperation is exemplary. Actually, we achieved a lot of things, and this is the prevention and reaction in cases of disaster or natural disasters. The cooperation goes on in the next years as well. It implies activation or setup of different instruments of tackling the results of catastrophes and natural disasters, enhancing the infrastructure and the capacity at local level to intervene in such situation, and sets up a network of specialists that are able to activate themselves in such situations. One good example, unfortunate one for the ones involved, was during the floods some years ago, when the support and help and the readiness of those instruments have helped and eased the life of several citizens.
Projekat u okviru podrške Evropske unije u razvoju hirurgije u nekim lokoregionalnim centrima podunavske oblasti i pogranične saradnje trajao je od 2017. do 2019. godine. Ima mnogostruki efekat i mnogostruki benefit u razvoju naše hirurgije, kako naše, tako i hirurgije bolnice u Temišvaru. Taj efekat saradnje i taj dobitak se oslikava u dobijanju nove opreme. Najsavremenije u to vreme, 2017. godine, prva 3D kamera i 3D laparoskopski stub u Srbiji je dobijen u Smederevu i u Sremskoj Kamenici posle toga, mislim, ili uporedo negde u isto vreme. I pored tog stuba dobijena je cela jedna hiruška sala, uključujući hiruški sto, reflektore, najsavremenije, LED reflektore, anesteziološka mašina, termokauter i sve što je neophodno za jednu savremenu medicinsku hirušku salu. Saradnja se zasnivala ne samo u dobijanju opreme, nego i u razmenjivanju iskustava. Ta iskustva su iz oblasti hiruške tehnike i usvajanja novih hiruških procedura u obliku organizovanja workshopova u Smederevu i u Temišvaru i izvođenja određenih broja operacija u Smederevu i u Temišvaru takođe. Gledali smo i prošla je čitava hirurgija Smederevske bolnice, svi su hirurzi bili u Temišvaru i većina hirurga Temišvarske hirurgije je bio u Smederevu. To se već jasno očitava i oslikava. Rumunija je nama bliska zemlja, naše prve komšije. Mi smo u toku tog rada i stručnog razmenjivanja iskustava videli koliko je hirurgija i koliko je zdravstvo te naše komšijske zemlje napredovalo, kako u opremi, tako i u usvajanju svih hiruških procedura. Dosta smo radili sa njima i dosta smo iskustva preneli. Neke nove procedure u rešavanju laparoskopskih hernija smo preneli iz Rumunije. Imali smo čak i neke radne workshopove na fantomima od svinja gde smo usavršavali operativnu tehniku abdominalne laparoskopske hirurgije. Oni su baš onako dosta napredovali unazad 10 godina. Tako da smo mnogo što mogli da naučimo od rumunskih hirurga u organizaciji službe, pa čak nešto u razvoju. Oni su univerzitetski centar i tamo je dosta mladih specijalizanata i lekara i studenta koji su čekali uveče kasno, onako pod svetlom, da se završe operacije da bi oni nastavili rad na tim fantomima. Tako da bilo je u svakom slučaju mnogostruko korisno i za nas i za njih.
Hiruška oprema koju smo dobili je veoma važna za nas, za naš rad, zato što se osjećamo sigurni, radimo kvalitetne operacije, minimalno invazivne, dobre za pacijenta, lakši i brži oporavak i u svakom pogledu nam je lakše.
Mi smo u svakom slučaju uporedivi. Gde se sad nalazimo mi u odnosu na zemlje Evropske unije, ne znam, mislim da su napravili značajnije korake, iskoraka ispred nas. Na šta smo ponosni? Pa ponosni smo što smo otvorili naša vrata jedne male provincijske hirurgije, eto, hirurzima iz Rumunije i hirurzima iz Amerike i pristupili operacijama hirurga iz Liona, Francuskog, koji su radili tamo u Temešvri. Znači, razmena iskustava u našoj oblasti je svakako jako bitna. Toga smo imali dosta.
Европска унија и Србија заедно граде бољи живот за све граѓане. Стало нам је до Европе, стало нам је до Србије и њених граđana. Бољи смо заедно.